And if you think Linda Mama was a big thing for you, how come it has not reduced the maternal mortality rate in our country? This is an agenda the president and myself want to start now. Linda Mama reimbursement rates under the defunct NHIF was as low as 2,500. Sometimes it's 5,500 per delivery in dispensary and health centers. The quality, the care, nobody bothered. There was a persistent high maternal mortality rate in our country. And by the way, it continued to occur despite the high number of mothers giving birth in hospitals. Your Excellency, you have given vulnerable mother or the vulnerable woman who goes to antenatal clinic, who deliver, and who has postnatal care. Don't listen to naysayers. The benefits of Linda Mama, as was said, has not been scrapped. Nobody has scrapped Linda Mama. But what have we done? We have enhanced the cover of Linda, of the mother, and added the family, the children. You are only taking care of the mama by giving her 2,000 or 5,000, and they could only access facility at dispensary and health center. We have 20 counties that we feel the maternal mortality rates are high. So if your Linda Mama was good, then how come the maternal mortality rates, and these are not figures, even the World Health Organization will agree with me, but we enhanced. What have we enhanced? Because we don't lie. We have enhanced, we have included antenatal, postnatal, delivery, and we have given the whole family that package. Today, in 9 months, since SHA was formed, Your Excellency, 17.5 million Kenyans visited health facilities. Over 10,000 health facilities. Of these 17.5, 12.5 million Kenyans accessed free primary care paid by the government of Kenya. They went to dispensaries, they went to health centers, they went to sub-county hospitals as outpatients, they went home without paying a coin. I don't know whether that is transformative or that is reducing the gains somebody else has made. Your Excellency, the other 5 million went through social health insurance fund by accessing specialized care in our level 4, level 5, and level 6. In 9 months, under SHA, we mobilized 70 billion Kenya shillings. 3 times or 4 times what NHIF could mobilize in many years. Today, Your Excellency, in 9 months under SHA, 627,155 mothers have delivered in the Republic of Kenya. Our delivery is about 1.1 million. We covered the mother, we covered the whole journey, prenatal, postnatal. We made her she deliver safely. If there was complication, we took her through cesarean. We followed the child. We followed the family. 627. And out of these, 41,000 of these were teenage mothers paid by Social Health Authority. In fact, all teenage mothers in our country, if they will deliver free. What does that mean? Under President William Ruto, we have introduced a more integrated system with financial protection, to all families. Today, in 9 months since SHA was formed, Your Excellency, 17.5 million Kenyans visited health facilities. Over 10,000 health facilities. Of these 17.5, 12.5 million Kenyans accessed free primary care paid by the government of Kenya. They went to dispensaries, they went to health centers, they went to sub-county hospitals as outpatients, they went home without paying a coin. I don't know whether that is transformative or that is reducing the gains somebody else has made. Your Excellency, the other 5 million went through social health insurance fund by accessing specialized care in our level 4, level 5, and level 6. In 9 months, under SHA, we mobilized 70 billion Kenya shillings. 3 times or 4 times what NHIF could mobilize in many years. The other day, a lot of misinformation was said about your health transformation agenda. And this is because never before in our country, your transformation health agenda is as clear as the day and the night. And we really want to ask those who want to critique us on our reforms, whether it's in the health sector, in education, in agriculture, to critique us with the facts and figures, not figures thrown like a pedestrian. And why am I saying so? Today, as we sit here, under your leadership, 26.5 million Kenyans have registered to the Social Health Authority with Kajiado County, and the governor is here, over 470,000. When in the previous administration, under the former NHIF, it was only 7 million. So from 7 million to 26.5 million, you'll tell us which one is transformative in the health sector. First, they said we are mobilizing this region, we are mobilizing this region. They said Ruto must go. They say, what these two, 1 term. Now, yesterday, they started a new story. That all these team were together, half of them are projects of Ruto. Can you imagine? Themselves are saying, you are a project, you are a project, you are a project. No agenda. Ruto must go, it's not an agenda for Kenya. This one is a project, it's not an agenda. Your Excellency, on behalf of these great people, we, this community, and who is who in this community? The religious leaders are sitting here. The political leaders are sitting here. Count on us. They left us with 30 billion fictitious NHIF debt. Out of that debt, Linda Mama debt under NHIF inpatient was 4.8 billion. Outpatient was 306 million. In total, my good friend, my former leader, you have left us with 5.6 billion Linda Mama. You should thank us. We did not look for the money. We did not went to public liars and said you left us. You left us with the many debt. But today, because you started it, Linda Mama left a debt with us, Your Excellency. This month, we paid 8.1 billion shillings to both public, private, and faith-based. Governor Lenku is my witness, Your Excellency, here. Today, the highest own source of revenue for our counties is the health sector. True or false? Because today more Kenyans go to public health facilities than to the dingy, small fraud things.
Our markets, 15 of them are coming to fruition. Our affordable housing are at an advanced stage. And we are soon going to have our people do their trading in urban centers in decent spaces, as opposed to where before people will go to those markets with gumboots. We want to thank you, Mr. President, for that transformation agenda. We support the agenda. We are proud as Kenyans to see the most vulnerable members of our society receiving your support through the affordable housing program, Mr. President. We have a very close working relationship with the university. Time and again, I have come to their halls here to attend functions that we carry as a county government. And I want to laud and emphasize the partnership we have with their School of Nursing, where their students practice at our referral hospital here in Kajiado. And that a number of Kajiado families have found support by the university here through their social programs. And this morning, Your Excellency, the Chancellor and I had a conversation to discuss about agriculture, where I committed that our demo farm here, they can use it as a university to demonstrate the best practices in agriculture and livestock re-engineering. As you are aware, Your Excellency, the county government is pursuing its vision of transformation through our Livable Towns program, our modulated pastoralism, where we are engineering our pastoralism so that we adapt with the modern times in our pastoralism. And education is a key anchor in our journey as a county government, and we have found a wonderful friend in Uma University.
To date, Direct Aid Society has invested over Kenya shillings 5 billion in the development of Umma University. This funding has supported infrastructure, academic excellence, and student services. Since Umma University was established, we have disbursed over Kenyan shillings 2 billion in scholarship and loans, ensuring that financial hardship does not block the path to ambition. From the heart of the people of Kuwait, we wish the people of Kenya great prosperity and economic development.
Since its inception, Umma University has remained steadfast in its mission to expand access to quality education. To date, we have admitted over 16,000 students across various disciplines and testaments to the trust placed in our institution by communities across Kenya and beyond. Of these, 6,567 graduates have graduated with diplomas, bachelors, and masters, and have successfully completed their studies and now contributing meaningfully to the society in diverse fields. These numbers reflect not only our growth, but the tangible impact of our academic programs in shaping lives, strengthening communities, and building a better future.